In last video, we had talked about basics of diabetes, signs and symptoms of diabetes. But why it is important? Why is diabetes so dangerous? So we are going to talk about today about microvascular and macrovascular complications. I'm Dr. Sandeep Desai, Advanced Diabetes Care Valsad. So let us briefly understand what are the micro and macrovascular complications, why are they important, and if we don't treat it, control the blood pressure, blood sugar, you can have this complication later on in life. At the same time, we divide the complications of diabetes into two major divisions. One is the acute complications and one are the chronic complications. Acute complications are which happens immediately, like type 1 diabetes are prone to diabetic ketoacidosis. Then there is one entity in type 2 called hyperglycemic hyperosmolar non-ketotic coma. Patient can go into coma if the blood sugars rise more than 800, 900. And third, and most common related to mainly therapy is hypoglycemia, which is low blood sugar. But let us concentrate on the chronic complication because those are important in the sense if we don't control diabetes today, at a later on after 5, 6, 10 years, you can get complications which will make you more morbid and increase the chance of mortality or death. There are microvascular and macrovascular complications in the long run. Microvascular are complications which affect the eye, the kidney, and the nerves of the body. And macrovascular complications are mainly cardiovascular, cerebrovascular, and peripheral vascular. Cardiovascular, that is the heart, the cerebrovascular, that is the brain, and the peripheral vascular disease, that is the arteries of the lower limb mainly. So that are called the peripheral vascular disease. These are disease of the large arteries, while the microvascular are, as we said, diabetic retinopathy, that is a complication of the eye, diabetic nephropathy in the kidney, and diabetes neuropathy, the nerves which take the message from the body all over the body from to the brain. And these are the areas where small arteries are affected, and that is called the micro. Small, micro means small. So if we just talk briefly about this complication in this video, and later on we will in the next subsequent video we'll talk about it in details. So just a brief of everything. One is, as I said, diabetic retinopathy. It's usually affect the eye. In type 2 diabetes, we have to check the eye from the day one, on the day one of diagnosis, and later on every 1 year or even 2 years, every 2 years if everything is normal. In type 1, because it occurs acutely, usually the examination is occurs after 5 years after the diagnosis. But type 2, on the day one, we usually see for retinopathy in terms of vision and fundus. Second is diabetes nephropathy. Again, the same. On the day of diagnosis, everyone should get tested for diabetes nephropathy. What is nephropathy? Kidney related, diabetic kidney disease. So there is a test called urine and a test called creatinine, which we normally do on the day one, and then 1 hourly, yearly, and then or 2 hourly, depending on if the patient is normal. Similarly, neuropathy, there are basic tests like monofilament test and vibration test, which has to be done on the day one. In fact, neuropathy usually patient comes with some symptoms and signs. In diabetic retinopathy and nephropathy, usually there are no symptoms. It occurs very late. So we have to prevent this complication, diagnose them early, and prevent them and prevent the complication further and treat them as early as possible. So basic, what are the treatment of all this? Finally, long-term control, good control of diabetes in terms of blood sugars, FPS, PP2BS, and A1C, blood pressure control, the lipids control, avoidance of smoking, and strict lifestyle modification. These are simple methods which can prevent all this complication. Similarly, if you see the macrovascular complication, which are the large vessels usually take the course in the heart, the brain. These are the main organs which are affected, and if the atherosclerosis occur there, the patient can die due to heart attacks or brain stroke. So this macrovascular complication also has to be prevented and taken care of, and we have to control diabetes, blood pressure, dyslipidemia again. Friends, this is in brief about the complications. And if you have liked this video, you can share it with your friends and family to make them more aware of diabetes and the complications. At the same time, in detail in the next video. We will make in the subsequent videos. We will go on with this series and will explain in details about this complication. Thank you again, and stay healthy, stay blessed, and control your diabetes. Thank you.